Question 1. A nurse is caring for a patient with acute kidney injury, AKI. Which laboratory value should the nurse monitor closely? A. Serum glucose. B. Serum creatinine. C. Hemoglobin. D. Platelet count. Answer: B. Serum creatinine. Rationale: serum creatinine is a key indicator of kidney function. In AKI, the kidney's ability to filter waste products is impaired, leading to an increase in serum creatinine levels. Question 2. A patient with a history of chronic kidney disease, CKD, is prescribed a low-protein diet. The nurse understands that this dietary modification is primarily to A. Reduce hyperkalemia. B. Decrease the workload on the kidneys. C. Prevent hypoglycemia. D. Lower blood pressure. Answer: B. Decrease the workload on the kidneys. Rationale: a low-protein diet is recommended in CKD to decrease the workload on the kidneys, as protein breakdown produces nitrogenous wastes that the kidneys must filter and excrete. Question 3. Which symptom would a nurse expect to find in a patient with a urinary tract infection, UTI? A. Bradycardia. B. Hypertension. C. Dysuria. D. Polyuria. Answer: C. Dysuria. Rationale: dysuria, or painful urination, is a common symptom of UTIs due to inflammation and irritation of the urinary tract. Question 4. A nurse is educating a patient with recurrent calcium oxalate kidney stones. Which dietary advice should the nurse provide? A. Increase intake of dairy products. B. Avoid foods high in oxalate like spinach and nuts. C. Consume more animal protein. D. Decrease fluid intake to reduce urine production. Answer: B. Avoid foods high in oxalate like spinach and nuts. Rationale: foods high in oxalate can contribute to the formation of calcium oxalate stones, so patients are advised to avoid them to reduce the risk of stone formation. Question 5. A patient is undergoing hemodialysis. Which finding should the nurse report immediately to the healthcare provider? A. Weight loss after dialysis. B. Decreased urine output. C. High blood pressure during dialysis. D. Fatigue after the session. Answer: C. High blood pressure during dialysis. Rationale: high blood pressure during dialysis can indicate fluid overload or an issue with the dialysis process, requiring immediate attention. Question 6. A nurse is caring for a patient post-renal transplantation. Which sign would indicate acute rejection of the transplant? A. Hypotension. B. Decreased creatinine clearance. C. Polyuria. D. Hypoglycemia. Answer: B. Decreased creatinine clearance. Rationale: decreased creatinine clearance indicates a decline in kidney function, which can be a sign of acute transplant rejection. Question 7. A patient with a history of renal calculi is advised to increase fluid intake. The nurse knows that this recommendation is primarily to A. Dilute urine to prevent stone formation. B. Increase urine pH. C. Decrease blood urea nitrogen (BUN) levels. D. Enhance calcium excretion. Answer: A. Dilute urine to prevent stone formation. Rationale: increasing fluid intake helps to dilute urine, which can prevent the concentration of minerals that form kidney stones. Question 8. Which instruction is most important for a nurse to give to a patient scheduled for a cystoscopy? A. Avoid eating or drinking after midnight before the procedure. B. You may experience pink-tinged urine after the procedure. C. An antibiotic will be administered before the procedure. D. You will need to hold your urine for several hours before the test. Answer: B. You may experience pink-tinged urine after the procedure. Rationale: it is important for patients to know that pink-tinged urine is a common and non-alarming finding after a cystoscopy due to minor irritation of the bladder and urethra. Question 9. A nurse is assessing a patient with end-stage renal disease, ESRD. Which symptom is most indicative of uremia? A. Hypertension. B. Pericarditis. C. Pruritus. D. Anemia. Answer: C. Pruritus. Rationale: pruritus, or severe itching, is a common symptom of uremia in ESRD due to the accumulation of waste products in the skin. Question 10. A patient with a urinary tract infection is prescribed ciprofloxacin. What should the nurse instruct the patient? A. Take the medication with a glass of milk. B. Limit fluid intake while on this medication. C. Avoid caffeine as it may increase drug side effects. D. You can stop taking the medication once you feel better. Answer: C. Avoid caffeine as it may increase drug side effects. Rationale: caffeine can increase the side effects of ciprofloxacin, such as nervousness and gastrointestinal discomfort, so it is advisable to avoid it. Question 11. A nurse is caring for a patient with a suprapubic catheter. Which action is essential for preventing infection? A. Changing the catheter daily. B. Using sterile technique during catheter care. C. Applying talcum powder around the insertion site. D. Limiting fluid intake to decrease urine production. Answer: B. Using sterile technique during catheter care. Rationale: using sterile technique is crucial in preventing infection in patients with a suprapubic catheter. Question 12. A patient with a history of renal failure is on a restricted potassium diet. Which food should the nurse advise the patient to avoid? A. White bread. B. Apples. C. Bananas. D. Rice. Answer: C. Bananas. Rationale: bananas are high in potassium and should be avoided or limited in patients with renal failure who are on a potassium-restricted diet. Question 13. A nurse is educating a patient on preventing urinary tract infections. Which statement by the patient indicates a need for further teaching? A. I should drink cranberry juice regularly. B. I will wipe from back to front after using the bathroom. C. I need to urinate after sexual intercourse. D. I should drink plenty of fluids throughout the day. Answer: B. I will wipe from back to front after using the bathroom. Rationale: wiping from back to front can introduce bacteria from the anal area into the urethra, increasing the risk of UTIs. The correct technique is to wipe from front to back. Question 14. A patient is scheduled for an intravenous pyelogram (IVP). Prior to the procedure, what is the most important question for the nurse to ask the patient? A. Are you allergic to any foods? B. Do you have a history of diabetes? C. Are you allergic to iodine or shellfish? D. Have you had any surgeries in the past? Answer: C. Are you allergic to iodine or shellfish? Rationale: intravenous pyelogram (IVP) involves the use of iodine-based contrast dye. Patients with allergies to iodine or shellfish may have a higher risk of an allergic reaction to the contrast dye used in IVP. Question 15. A nurse is caring for a patient who just underwent a cystectomy with the creation of an ileal conduit. What is the priority nursing intervention for this patient? A. Monitoring fluid and electrolyte balance. B. Encouraging high-fiber diet. C. Teaching self-catheterization. D. Assessing for urinary incontinence. Answer: A. Monitoring fluid and electrolyte balance. Rationale: after a cystectomy with ileal conduit formation, monitoring fluid and electrolyte balance is crucial due to the risk of dehydration and electrolyte imbalances, as a segment of the intestine is used to create a new pathway for urine. Question 16. A patient with a history of nephrolithiasis is experiencing severe flank pain and nausea. The nurse should prepare the patient for which diagnostic test to confirm the presence of kidney stones? A. KUB X-ray. B. Renal ultrasound. C. CT scan of the abdomen and pelvis. D. Urinalysis. Answer: C. CT scan of the abdomen and pelvis. Rationale: a CT scan of the abdomen and pelvis is the most effective diagnostic test for confirming the presence of kidney stones, as it can detect even small stones and provide detailed images of the urinary tract. Question 17. A nurse is providing discharge instructions to a patient who had a urinary tract infection. Which statement by the patient indicates a need for further education? A. I will drink at least 8 glasses of water each day. B. I will take the prescribed antibiotics until they are finished. C. I can stop taking my medication if my symptoms are gone in a few days. D. I should avoid drinks with caffeine and alcohol. Answer: C. I can stop taking my medication if my symptoms are gone in a few days. Rationale: it is important to complete the full course of antibiotics as prescribed, even if symptoms improve or resolve, to ensure the infection is fully treated and to prevent antibiotic resistance. Question 18. A nurse is caring for a patient with a nephrostomy tube. Which action is essential in the care of this patient? A. Irrigating the tube daily. B. Keeping the skin around the tube dry and clean. C. Clamping the tube for 2 hours daily. D. Applying a heating pad to the site to reduce pain. Answer: B. Keeping the skin around the tube dry and clean. Rationale: keeping the skin around the nephrostomy tube dry and clean is essential to prevent infection and skin irritation. Question 19. A patient with chronic kidney disease is prescribed erythropoietin. The nurse knows that this medication is given to treat which condition commonly associated with CKD? A. Hypertension. B. Anemia. C. Hyperkalemia. D. Acidosis. Answer: B. Anemia. Rationale: erythropoietin is prescribed to treat anemia, which is a common complication of chronic kidney disease due to decreased production of erythropoietin by the kidneys. Question 20. A nurse is educating a patient on the prevention of cystitis. Which dietary recommendation should the nurse provide? A. Increase intake of citrus fruits. B. Drink cranberry juice regularly. C. Consume a high-protein diet. D. Avoid caffeine and spicy foods. Answer: B. Drink cranberry juice regularly. Rationale: cranberry juice is believed to help prevent cystitis, bladder infections, by preventing bacteria from adhering to the bladder wall. Question 21. A patient with a history of renal calculi is experiencing severe pain and hematuria. What is the priority nursing intervention? A. Administering pain medication as prescribed. B. Encouraging increased fluid intake. C. Preparing the patient for surgery. D. Instructing the patient to strain all urine. Answer: A. Administering pain medication as prescribed. Rationale: the priority nursing intervention for a patient with renal calculi experiencing severe pain is to administer pain medication as prescribed to manage the pain effectively. Question 22. A nurse is caring for a patient who is scheduled for a renal biopsy. What is the most important post-procedure care for this patient? A. Encouraging ambulation to prevent deep vein thrombosis. B. Monitoring for signs of bleeding. C. Ensuring a high fluid intake. D. Checking blood pressure every 15 minutes. Answer: B. Monitoring for signs of bleeding. Rationale: after a renal biopsy, monitoring for signs of bleeding is crucial because the kidney is highly vascular, and there is a risk of hemorrhage post-procedure. Question 23. A patient with a urinary tract infection is prescribed trimethoprim/sulfamethoxazole. The nurse should instruct the patient to: A. Take the medication with an antacid to reduce stomach upset. B. Drink plenty of fluids while taking the medication. C. Avoid sunlight due to the risk of photosensitivity. D. Skip doses if side effects occur. Answer: B. Drink plenty of fluids while taking the medication. Rationale: it is important to drink plenty of fluids while taking trimethoprim/sulfamethoxazole to help flush the urinary tract and reduce the risk of crystal formation in the urine. Question 24. A nurse is assessing a patient with glomerulonephritis. Which symptom would the nurse expect to find? A. Polyuria. B. Hypotension. C. Hematuria. D. Hyperkalemia. Answer: C. Hematuria. Rationale: hematuria, or blood in the urine, is a common symptom of glomerulonephritis due to inflammation and damage to the glomeruli in the kidneys. Question 25. A nurse is caring for a patient who recently had a urinary catheter removed. Which symptom would indicate the need for immediate intervention? A. Mild discomfort in the lower abdomen. B. Cloudy urine. C. Inability to urinate for 6 hours. D. Increased frequency of urination. Answer: C. Inability to urinate for 6 hours. Rationale: inability to urinate for 6 hours after catheter removal can indicate urinary retention, a potentially serious complication that requires immediate intervention. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.